And now our feature, Gender, Mutual Respect, Love, Marriage, and the Family.
HAART is the name of one of the main projects of South Africa's Blessed Gerard Care Centre. HAART, that is HAART, stands for the Highly Active Anti-retroviral Therapy, and this particular project is part of one of the world's largest NGO programs of its kind, that is the AIDS treatment program of the Catholic Bishops of Southern Africa. We shall learn more about HAART shortly. First, let's reflect on our interview with Father Gerard Lagleder last week on this feature, when he shared about the need to inform people about how HIV AIDS can be transmitted so as to combat misinformation, which, as we heard, can lead to the tragic abuse of children. Traditional healers should learn the truth, and we heard that Catholic youth groups and schools are trying to guide the youth with the right information. Another branch of the Blessed Gerard Care Centre is the hospice, and Father Gerard begins today with an outline of their work.
Our hospice has the largest inpatient unit of any hospice in South Africa. We have got 40 beds, and that means we have quite an impact and we have quite a task to look after all those many sick people there. Our beds are usually occupied, and sometimes we have to wait and look after a patient through home-based care until we can accommodate the patient in our inpatient unit. And sometimes the bed is not even cold yet and the next patient comes in. We have such a demand on our inpatient unit. As I said already, we do home care as well. We don't do home-based care in the sense of sending out semi-trained home carers, but what we do is we have professional teams. We have always at least a nurse on our team who goes out and does the home visits of our patients. We have more than 600 patients in regular AIDS care at the moment, and we have got a few hundred of other people who we are looking after. The third thing we are offering in our hospice is day care, and that means that somebody who is working has the chance to bring their patient to us for day care. We look after the patient, do all the treatments that are necessary, and in the evening the patient goes home. The patient remains in his home environment. He is not institutionalized, but on the other hand, during the day the patient gets all the treatment that he needs. And last but not least, what we do in our hospice is training, and we do two kinds of training. Number one, we are training nursing personnel, and we do a kind of an auxiliary nursing course where we train people to become volunteers so that they can help our registered nurses and our doctors in our hospice. But we also do home care training for the general populations to enable them and to encourage them to look after their relatives at home.
From the work of the hospice, Father Gerard turned to the HAART project, which, as we mentioned earlier, stands for Highly Active Anti-retroviral Therapy.
This is actually what makes us so strong and so successful. First, I would like to say that we are part of the largest non-government AIDS treatment program, as much as I know, even of the whole world, and that is the AIDS treatment program of the South African Catholic Bishops' Conference. And we have been the fourth program of these, it's now 24, of HAART clinics who are doing that treatment and training. What we are doing is, before the patient gets the first medication, we make a 3 weeks preparational course. We call it a HAART readiness course. HAART is an abbreviation for Highly Active Anti-retroviral Treatment. And that means that we give the people medication which is not, unfortunately, not able to kill the virus in the human blood, but it can stop it from replicating, which means it can stop the virus from spreading in the blood, and we call it viral replication, which means the virus is multiplied in the human blood at an astronomical rate. And basically a patient in full-blown AIDS has got more than 1 million, up to 1.5 million of viral copies per cubic millimeter, and through that treatment we can reduce that to what we call an undetectable viral load, which means less than 50 copies per cubic millimeter. And that means the patient improves tremendously in his state of health. Mothers can go back and educate their children, raise their children. The men can go back to work, and they are feeling fine and well. And what I wanted to say before is, what we do is we do that 3 weeks training, because we have many people who sign with their thumbprint. We have many people who think that sickness is caused by evil spirits, by people bewitching them. And so we have first to tell them what is a germ, how does the AIDS virus come into your body, what does the AIDS virus do in your body, how is the medication preventing that virus from doing what it does, and thirdly, how do you have to live and change your lifestyle to live a healthy life, so that through your treatment and through a change in your lifestyle, you can live for a long, long time. And the last thing which is extremely important in the preparation of an AIDS patient is to warn them about side effects. Because unfortunately, AIDS treatment has a high risk of side effects, and many patients, as soon as they get one of the side effects, would stop taking the medication. And the big problem with that is that if you only forget 2, 3, 4 times in a row to take your medication, the virus can mutate, which means it changes in a way that it becomes resistant to the medication. And even if they take the medication afterwards again, it is of no use. It doesn't work anymore. And that we have to prevent from happening by a proper training of our patients.
The danger of forgetting to take anti-retroviral therapy for just 1 day, pointed out by Father Gerard Lagleder in this third part of an interview he gave to the Africa service of Vatican Radio about the work of the Blessed Gerard Care Centre, which is located in Mandeni, South Africa.